Do you frequently feel like your heart pains sometimes? Or maybe you're always tired, even after sleeping all night? What if I told you these signs could mean something up with your blood? Let's talk about chronic lymphocytic leukemia, or CLL for short. Imagine your body is like a factory that makes blood cells. In CLL, the factory starts making too many broken white blood cells, lymphocytes, that don't work properly. These lazy workers pile up and block healthy cells from doing their job. At first, you might not notice anything, kind of like a slow internet connection that you barely feel. But over time, things get worse. The good news: CLL grows very slowly. So many people live with it for years without even knowing. That's why it's super important to pay attention to your body's small signals. So what causes CLL? Well, doctors still don't know the exact reason, but it's not something you catch like a cold. It starts with tiny errors, like typos, in the instructions DNA of your white blood cells. These typos happen as you age, which is why CLL is more common in people over 50. Think of it like a copy machine, making one bad copy that keeps getting duplicated. Risk factors include family history. If a close relative had blood cancer, your risk goes up, and being male or of Caucasian descent. But here's the key: it's not caused by germs, diet, or lifestyle choices like smoking. So no, it's not your fault. Your body just had a small glitch in the system. Now, do you often get sick and can't seem to shake off colds? Or maybe your glands, like under your neck or armpits, feel swollen all the time. These could be signs of CLL. Other clues: feeling tired for no reason, losing weight without trying, sweating a lot at night, like your bed gets soaked, and easy bruising. Some people even notice tiny red spots on their skin or feel full quickly when eating, because an enlarged spleen is pressing on the stomach. But here's the tricky part: many people with early CLL have no symptoms at all. It's often found during a regular blood test for something else, like a pre-surgery checkup. So ask yourself, when was the last time you had a blood test? Sometimes, silence is the loudest symptom. How do doctors know it's CLL? First, they check your blood. If the report shows too many lymphocytes, they dig deeper. They might say, let's do a flow cytometry test. That's just a fancy way of tagging your cells with glowing markers to see if they're abnormal. Sometimes they check your bone marrow, the factory inside your bones, but not always. Once CLL is confirmed, they watch it closely, but don't panic. Treatment doesn't always start right away. This is like having a spider in the house. If it's not bothering you, you just keep an eye on it. When treatment is needed, doctors use targeted drugs like ibrutinib that block the signals telling bad cells to grow. Or they may use immunotherapy, which helps your body's immune system hunt down the bad cells. Chemotherapy is less common now, thanks to gentler, smarter options. Can you prevent CLL? That's a great question, but right now, there's no sure way to stop it before it starts. Since it's not caused by germs or lifestyle, you can't avoid it like the flu. However, you can take charge of your health. For example, go for regular checkups, especially if cancer runs in your family. It's like having a car service. Even if the engine sounds fine, you still check the oil. Knowing your body helps you catch changes early. And while you can't change your genes, you can boost your overall health with good food, exercise, and avoiding smoking. Think of it as strengthening your team, so your body can handle surprises better. Here's some hope: science is moving fast. Researchers are working on smart drugs that target only cancer cells, leaving healthy ones alone. Imagine a missile that hits only the bad guys. That's what drugs like venetoclax do. Some studies are testing combinations of pills that can put CLL into deep remission without chemo. Even cooler, CAR T-cell therapy, where doctors take your own immune cells, train them to attack cancer, and put them back in. It's like turning your body into a superhero. And new blood tests can now track tiny amounts of cancer after treatment, helping doctors act fast if it returns. All of this means better, longer lives for people with CLL. And one day, maybe even a cure.